whatever the cause, crowding is a discrepancy between the mesial distal width of the teeth and the length of the ideal dental arch. So it stands to reason if we can reduce that mesial distal width within the confines of that ideal dental arch, we can alleviate crowding. So what do? We gain that space locally where we need it with interproximal polishing, stripping, IPR, enamel reproximation, reprox for short. Gain that space locally where you need it and then move the teeth into that newly created space. So reprox and shape memory nickel titanium work synergistically together to give these patients great smiles very quickly. Now, reprox has been done for a long, long time. It was first described by Ballard way back in 1944, and it's a very conservative method used to alleviate crowding for your patients. Another thing that reprox does is it can be done in such a way that you can kind of flatten or keystone contacts together so those teeth are less likely to slip off each other and to relapse. And you basically can perform reprox whenever you need more space. The only limit is the amount of enamel on the teeth. Another thing that I think just isn't mentioned enough concerning reprox is that it reduces friction between the tooth contacts. What's the enemy of movement? It's friction. So if you can reduce friction, reduce those teeth wanting to collide with each other, they can glide past each other, allows for very, very efficient, fast tooth movement. And you can gain a lot of room from reprox. If you were to reprox from the distal of the canine to the distal of the canine, you can gain 3, 4, 5 millimeters of space, all depending on how wide the teeth are, how much enamel's on the teeth. But you can gain a significant amount of space. Now, how do you do it? I'm going to show a little video in a second, but I find the easiest way to do it is to take a diamond disc in a slow speed straight nose cone. Okay? You're going to take that right down through the contact all the way to the gingival margin. You're going to follow up then with a finishing burr in your high-speed handpiece to do any cosmetic recontouring that you may need to do, and then finish up with a diamond strip. This will quickly, easily, and with no pain to the patient, give you the room that you need. Now, you can only use the disc when you have contacts that are reasonably well aligned. When you have rotated teeth, you cannot use the disc because you will alter the facial or lingual enamel. We want interproximal reduction only. In effect, what we're doing, we're shrinking those teeth mesial-distally. So when you have teeth that are well aligned, you can get a disc in there. However, when you have teeth that are rotated or overlapped, you cannot get a disc in there without altering the facial or lingual enamel or the tooth morphology. But what do you have when you have these overlapped teeth? You often have an interproximal surface just staring you in the face. What you can do is just take a finishing burr right to that exposed surface, okay? Shrink that tooth in the area of the future contact point, okay? Then get in there with a diamond strip and just kind of release some of that pressure, reduce some of that friction between the teeth so that they can move more efficiently. Now, you don't have to break contact in these situations, okay? Don't worry so much about breaking contact. You're reducing the future contact area, so as the teeth align, by the time they get there, they're already smaller, okay? You're going to see that we do reprox and move, reprox and move, reprox and move. We never do all of our reprox up front. It's a very progressive kind of way to do it, okay? Reprox, move, evaluate. Reprox, move, evaluate. Now, here is the Rolls-Royce of reprox discs. If you learn nothing else from this video, learn to get this reprox disc. It is available from Comet. It's a 934 HD 220, okay? And it is just 0.8 millimeters thick. It fits perfectly into the contacts between those two teeth. It also has a honeycomb appearance to it, okay? This allows you to see through it, gives you fantastic visualization of where you're reproxing, okay? This is just literally the best disc on the market. Now, care must be taken when you are reproxing to guard the soft tissue. Now, they do sell little guards that can go over the disc and just leave, like a quarter or less of the disc showing if you like. I've never used one of those discs. I just use normal retraction procedures like I do in any dental procedure, okay? You know, retract the lip. If you're working on the lower arch, have your assistant come in with the mouth mirror or high-speed suction, retract the tongue. Go on, do your reprox, get in and out. Now, I have reproxed hundreds of thousands of teeth, and I have never cut one lip or tongue because I use normal retraction procedures, so it's very safe for your patients if you're taking the appropriate care. Now here's the net result. You can see the amount of enamel removed is quite small, but it's enough to help us get these teeth moving and to shrink the teeth so they're already smaller when we get to our beautiful ideal arch form. And remember, you can do more reprox at subsequent visits as you need to. We never do it all at once. We reprox and move, reprox and move, reprox and move. Now here's a case where we have crowding. We're going to need to do reprox. Now, we have a lot of rotations in this case. Let's take a look at that upper arch. A lot of rotations. So I'm not going to be able to get the disc everywhere, but I always ask myself, where can I get a disc? Because that's always going to be a little quicker and easier to use the disc than to use a finishing burr or diamond strip. So what am I really asking myself? If I want to use a disc, I want to know where are contacts well aligned. Well, the contacts are well aligned in these two positions, okay? So when I have contacts that are well aligned, I can get the disc through them and reprox both teeth simultaneously. Now in the lower arch, there are no contacts aligned at all, so I'm not going to be able to use the disc at all. Instead, I'm going to take a finishing burr on the future contact area and get in there with a diamond strip to help relieve some of the friction between the teeth. Again, reprox and move them, reprox and move them, reprox and move them. Now here's a little video that's going to show some reprox in action. You're going to see how we use the disc to go ahead and get that reprox done. So you can see I'm retracting the lip, and you're just going to make sure you floor the rheostat, okay? Don't feather it, or otherwise the disc can kind of catch on you. So go ahead, floor the disc, go right down to the gingiva, in and out. So floor the disc, in and out. Now we're going to follow up with a finishing burr in the high-speed handpiece. We're going to do any additional contouring we need to do. And now we're going to finish up with a diamond strip. Now look at this next contact here. Do you see how that diamond strip's a bit tighter? I couldn't get the disc there because the contacts were more overlapped. You should be able to do reprox very quickly, easily, and efficiently. How long did that take me? Maybe a minute, and I was going slow for the camera. You should be able to do it very quickly and easily for your patients. Now I'm going to show another reprox video. In this reprox video, we're going to use the finishing burrs more because we have more rotated teeth. But again, we're still going to get the disc wherever we can. In other words, wherever contacts are reasonably well aligned. So where contacts are well aligned, go ahead and use the disc. And again, floor the disc and then drop it through the contact down to the gingival margin. Floor that disc and drop it right through the contact. Floor it, drop it right through the contact down to that gingival margin. Now on those centrals, we cannot use the disc because the contacts are not well aligned. We have rotated teeth there. So what you can do is take your finishing burr right on that exposed mesial surface at the future contact area. So you're shrinking the teeth by the time it gets to that, perfect upper arch form. Again, right on that future contact area. Go ahead and shrink that tooth mesial distally. Also, anywhere you used the disc, don't forget to follow up with a nice little contour with your high-speed handpiece. Now look at the great access we have to the mesial disc canine. Okay, you're never going to get better access. Take that finishing burr right on the future contact area and shrink that tooth. We also are going to have great access to the distal of that lateral incisor. So get in there and shrink that future contact point. Reprox is done very quickly, very easily. Anyone who can place a class 4 composite, which should be any dentist out there, can easily reprox using the burr. Okay? Anyone.
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live-seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/PowerproxLab.